Good afternoon. My name is Sylvia Steffen. I am a registered dental hygienist, and I want to discuss with everyone today the prevention of early childhood caries. Early childhood caries is also known as baby bottle tooth decay. That's what it was previously known as. Most people still refer to that name. It can also be identified as nursing bottle tooth decay or nursing bottle syndrome, and also it's been called bottle rot, meaning rotting the teeth. Early childhood caries is described as a childhood epidemic by the World Health Organization. It is a disease that most people don't recognize as being as serious as it is worldwide. And it's prominent especially with individuals of a lower socioeconomic status and individuals that reside within underserved economic areas. Most of this is on education, and the reason why I thought this was a very important topic is because if I can educate you, the pregnant moms, on how to take care of your baby's teeth, once the child starts to develop teeth and form teeth, then maybe we can prevent this epidemic from continuing and from causing unnecessary pain to your child. Early childhood caries is considered an infectious disease, and it's characterized by extensive decay or caries affecting the child's primary teeth. Primary teeth meaning the baby teeth, and most individuals do not think the baby teeth are important. However, they are very important because they do hold the spot for the permanent tooth to come into place. So if the child loses its primary teeth or its baby teeth too early, sometimes that can hold up development and eruption of permanent teeth as well. The American Dental Association defines early childhood caries as the presence of one or more decayed, whether it's non-cavitated or cavitated lesions, missing due to a cavity, or filled tooth surface in any primary tooth in a preschool age child between birth and 71 months of age. And so just to explain what cavitated or non-cavitated lesion is, the lesion would be the decay, and cavitation would be if the decay has not been taken out of the tooth and filled, or if the decay has been taken out and there's a filling in the tooth. That would be considered a cavitated lesion, so the tooth would be filled. Now remember that a child is not going to be like an adult sitting in the dental chair. So the younger the child gets decay or caries, the more difficult it is to treat, and the more extensive the treatment is for that child. Sometimes all the way from having the child to be put under general anesthesia in order to treat the decayed or the infected teeth. Early childhood caries is the #1 childhood disease experienced by children worldwide, much of it going untreated, and that's basically because moms or caregivers do not recognize that there is decay in the baby's mouth. And when we talk about this being the #1 childhood disease, we hear so much about asthma being so prominent in children. Actually, early childhood caries is more prominent in children than asthma is. So what this picture shows is from the first tooth. It's saying that dental caries is a chronic infectious disease. And when we say infectious, that means that it is contagious. And most people don't realize that dental decay is contagious because your baby is born with a mouth that has absolutely no bacteria in it. And the only way the baby gets bacteria in its mouth is through the mother or the caregiver kissing the baby on its mouth, maybe warming up food and mom tastes the food to see if it's too warm for the baby. Her saliva gets into the food and then it's passed on to the baby. So it is transmissible. And it comes from, like I said, mom or caregiver passing it on to the baby. The bacterial byproducts in the baby's mouth create acids. And that acid, just like any sort of acid, it basically burns holes in the child's teeth. And what that results in is the loss of tooth structure, um, pain, especially the younger the child is when they develop decay, eventually tooth loss and systemic infections. And that's a big issue with children because they cannot tell you that they're in pain, and the pain can be present and infection be present, and until it has spread, sometimes the swelling, that the mother will see the swelling until it has gotten to that point. Then we're at a point where the child's going to need to be on extensive antibiotics to get rid of that systemic infection as well. With early childhood caries, the child suffers unnecessarily on a daily basis from infection, pain. Like I said, a lot of times these children have to be put under general anesthetic and have all their teeth removed. Eating disorders because their teeth hurt when they're trying to chew. Speech disorders because a lot of times the teeth are extracted, which interferes with speech. Social disorders, and many days of missed school because of pain. Early childhood caries is primarily caused by the child's caregiver putting the child to bed with a bottle filled with a sugary substance such as milk, juice, pop, Kool-Aid. If left untreated, once again, it can cause pain, infection, nutritional issues, extractions. And I don't want to lead you down the wrong path and let you think that it's only from a bottle. It can also be from nursing as well, and a lot of moms use nursing as a pacifier for the baby. So we kind of want to get away from that. We call that an unnecessary feeding. So once the baby feeds, we don't want to continually allow the baby to be nursing or just sucking on the bottle just for the pacifier. So this little diagram that I have shows the bacteria, which we just discussed, that's transmitted from mom to baby, plus sugar, and the sugar once again would be from milk, Kool-Aid, juices. A lot of people say, oh, well, I will mix the juice half and half so it breaks down. That's still not acceptable. You can feed the baby the juice and then take the bottle from the baby. They should not be sucking on it for long periods of time. So you take the bacteria that's already in the child's mouth with the sugar. It creates an acid, just like any sort of acidic pop or lemon juice. That's all acid. It creates an acid, and that acid on the tooth will erode or break down the enamel, which causes eventually the cavity. And these are just some pictures of children with early childhood caries. You can see the destruction on the front teeth, and you can see in the other picture the little girl's laying in bed sucking her bottle. And primarily what happens is that baby falls asleep with the bottle, and mom doesn't want to take the bottle out of the baby's mouth because the baby's sleeping, and she doesn't want to wake him. So that just lays on the baby's teeth for whatever period of time. Once again, this is just kind of the same description: sugary, sticky foods. The bacteria in the mouth creates the cavity. According to the American Dental Association, again, because of the cariogenic bacteria, especially that the bacteria that actually causes decay is this streptococci mutin. They're transmitted soon after the baby's teeth erupt, and the American Dental Association kind of believes that if mom has a healthy mouth and the bacteria levels are very low in mom's mouth, the risk of passing that bacteria to the child is it's reduced. So making sure that your teeth are clean as well is very important for your child. And once again, here we go, the American Dental Association recommends that parents, even expecting parents, be encouraged to visit the dentist to ensure their own oral health. And that would include making sure that the bacteria content is reduced in your mouth by having your teeth cleaned and any decay that would be active in your mouth taken care of. And this is just a dental chart of a baby's mouth, and on the top of this chart are the baby's top teeth, and on the bottom are the baby's bottom teeth. And the first area that you will see early childhood caries beginning are the very front teeth on the top. That's just right where the bottle, right where the sugary liquid hits the teeth first are going to be the top front teeth. Then it extends back to the top molars. Then the decay drops down to the bottom molars, and the very last area, or the least susceptible to caries, are going to be the lower front teeth on the child. And it's just a direct correlation between having that bottle in the mouth and where the highest concentration of sugar hits the baby's teeth. Once again, you can see here are some pictures of early childhood caries. The very beginning, the white chalkiness on the baby's teeth, that's the beginning of decay. That's called a decalcification, meaning a breakdown in the enamel. The next moderate level, you can see the enamel has broken down. It's probably not soft yet, meaning decay, but then you can see where it's severe. And if you look at all three of these pictures, all of this early childhood caries begins on the top teeth. Once again, another picture of what the extensive destruction that this disease does to the child. Once again, same thing. You can see the four front teeth are decayed all the way down to the gum, and you can see all the way back to the molars where the decay has eroded the teeth. In this picture, we're just kind of looking at the top of the tooth where the decay comes into, penetrates through the tooth into the nerve of the tooth, which is that brown area. And then you go down and you can see where it says abscess. It's like a little yellow area on the very bottom of the root of the tooth. And that's actually an abscess, an infection that is created. So you can see where it's laying. It lays right on the nerve of the jaw. So that's why that's so painful for the child. In this picture, you can see this little bubble or bump above the tooth that's decayed. That's that infection that we saw in the previous slide, that little bubble at the apex of the tooth or the bottom of the tooth. That's what that bubble is right there, and this is where actually the infection has penetrated through the gum and is coming out the gum. And that bubble is filled with basically pus. Same thing in this picture, you can see the bubble alongside the tooth. That's an infection. Same thing in both of these pictures. You can see the bubbles outside the teeth. Those are abscess on, you can see the decay, the brown spot in between the first two teeth, and the infection that has penetrated out through the gum. This is just a picture of a child that has an infection. You can see how much swelling that the child has. That swelling can move to the child's brain quite easily. That's why it's so important to address this early on. Same thing here. Very, very bad infection with this poor child. Same thing here. Infection. This is probably on a lower tooth. You can see it spreading down her neck, her throat. That can actually close off the airway for the child. You can see how red and hot that swollen infection in the baby's mouth. So what can we do? Prevention. Only allow the child a bottle with meals. Do not let the child have the bottle in between meals, using it as a pacifier. A healthy diet, limiting sticky, starchy foods. Once the baby does get teeth, you don't want to be giving them gummy bears or raisins or dried cranberries, because those stick in the baby's teeth and will cause decay. As soon as possible, we want to encourage the child to drink from a cup so that they're not laying there sucking on a bottle. As soon as you can start wiping the baby's gums with a warm washcloth just to reduce any bacteria that's in the baby's mouth. Same thing when they start getting their teeth. You can initially start wiping it with warm washcloths or a piece of gauze. You can clean the teeth with that until you're able to actually use a toothbrush with the baby. The sooner you can get the baby used to having a toothbrush in their mouth, the better. If the child is under 2 years old, just use a smear of toothpaste, because we don't want the baby to be swallowing fluoride. That could actually be dangerous if the baby ingests too much fluoride. Once the baby's over 2 years, you can use a pea size of toothpaste to brush their teeth. Now remember that fluoride is very important for the child's teeth on the outside, but at this point we don't want them swallowing it, because they will be drinking water that comes from city water systems that has fluoride already in the water. So we don't want the baby to have a double dose of fluoride. Encourage fluoridated water with a bottle. And that doesn't mean bottled water, because unless it says fluoride is added to that, most often there's no fluoride in the bottled water that you buy at the grocery store. Do not use a bottle or nursing as a pacifier, and schedule your child's first dental exam at about 6 months of age. A lot of times if you go for your dental checkup, bring the baby. And most offices will not mind taking a look at the baby's oral cavity just to make sure that everything looks healthy. And then usually by the time the baby's about 18 months or 2, the dentist or the hygienist should be able to get in there and really kind of look around and see if there's anything obvious going on in the child's mouth. So here's a picture. We just want to make sure the baby's drinking water from the bottle. We want to make sure the baby's brushing, or that mom's cleaning the baby's teeth, so we're removing any plaque or any bacteria that's in there, and that the child is going to see the dentist or hygienist. So in conclusion, early childhood caries is caused by a bacterial infection from mom given to the infant shortly after birth. Allowing the child to drink sugary drinks such as juice, Kool-Aid, milk from a bottle, or also breastfeeding for an extended period of time increases the risk for early childhood caries. It can lead to extensive decay. Prevention is the best option for early childhood caries. We do not want the child to get in a predicament where they're in pain and the child has to be put under general anesthesia to be treated. We don't want that. So let's try and prevent the early childhood caries. Only water from a bottle in between feedings, and like I said, we would like the water to be fluoridated. Fluoride helps to prevent decay remineralize teeth that might be starting to decay. And fluoride is also antibacterial, so it does help to reduce the bacterial count in the individual's mouth as well. Make sure you're cleaning the baby's mouth and that the baby will have a dental exam within 6 months of age by a dentist or a registered dental hygienist. So that being said, I will be hanging around for a few extra minutes if you have any questions that you want to address with me after we break up our session. I'll be more than happy to hang around and answer any questions for you. And I wish you the best of luck with your delivery and your new baby. Thank you.